Hello, and welcome to part 2 of this CVED cardiovascular training. We're actually doing this in order to educate, motivate, and ultimately prevent tragic cardiac events, such as heart attacks, strokes, and sudden cardiac death. So let's get to it. In this part, you're going to learn all about digital pulse wave analysis, what exactly we're doing with this and how it works, what to expect in this screening process, and really to illuminate and define and articulate what these parameters are that we're looking at, and how each of these parameters relates to your health, and of course ultimately what we can do about these things in the short term and the long term to promote a long and healthy life. So how do we measure the health of the endothelium in a real-time, non-invasive manner? And how can we measure effectiveness of treatment choices and lifestyle changes? So a few questions that we need to consider as we move forward. Now, understanding about what digital pulse wave analysis screening is. We're actually using a non-invasive medical device. It's a type 2, which just simply means that it's non-invasive. It's got extremely accurate measurements to the tune of about 99.7% accuracy in what the machine is showing. It's a very quick process to administer. It takes about 1 to 2 minutes. It's Health Canada and FDA approved and certified to be used as medical equipment. So the pulse wave benefits are actually, there's quite a bit to even mention here, but really it comes down to we're screening the risk factors by having an early detection system, looking at the abnormal arterial wall function. We're identifying whether there's arteriosclerosis and arterial aging. We're monitoring the effective treatments for clients with hypertension and other cardiovascular imbalances, evaluating the efficacy of prescribed lifestyle modification and medications. So we can actually do follow-up with people who have been prescribed protocols, lifestyle, diet, nutraceutical, or pharmaceutical regimens. And we can also refer clients for appropriate care when we do spot areas of concern. And we are building a robust network of holistic practitioners, cardiologists, and medical physicians that we can refer people to if there's something that really needs to get looked at and formally diagnosed. We're actually looking at 8 areas in particular that we're doing in measurement. We're doing the electrical output of the heart, which is something called recognition. We're also doing ejection time, which is looking at the speed of the opening and closing of that left ventricle valve. We look at a resting heart rate, your pulse rate, the pulse height, which is stroke volume, and the pressure volume with each heartbeat. We're also looking at a PTG waveform, this plethysmograph, which is before the blood leaves the heart and exits into the body, there's a electrical wave that travels to the toes and back, and it moves much faster. That velocity is much faster than the blood itself. And we can also determine whether there's irregularities in that heartbeat. We're also doing a circulation analysis to determine whether there's blockage. And of course, when the circulation is open, everything's flowing good. That's what the parameter is looking at and what we're looking for in particular. The APG waveform is something called an accelerated plethysmograph. And we can determine by looking at the APG what kind of biological age we're looking at from someone on the inside. And it's not uncommon to have a 35-year-old that has the arteries of a 60 or 70-year-old, and vice versa, a 7-year-old coming out with the arteries of a 30-year-old. And of course, that's what we want. We want to lead people down that pathway to get them to a place of health where longevity is something that can be attained, absolutely. So why is recognition critical? Well, because recognition is the equivalent to an electrocardiogram, an ECG. Electrocardiograms, when you go to a doctor and he does an ECG on you, he hooks up a bunch of probes to your chest area, and what they're looking for is an electrical disturbance. See, about 300,000 to 500,000 people in North America die from something called sudden cardiac death. This is when you hear about the 21-year-old hockey player, he's fine 1 minute and he's dead the next. Now, that has nothing to do with clogged arteries, and it has nothing to do with cholesterol. It has to do with the beat of the heart. Because the heart is an electrical conduction system. It creates its own electricity. And because it's producing its own electricity, it's using electrolytes to do this. Of course, this happens in the SA node of the heart. We want to get too much into the science of that right now. But what we do need to know is that when it becomes chaotic, it can lead to a fibrillation or an arrhythmia. begins to get chaotic or flip-flop. And of course, going unchecked, this can lead to a very tragic cardiac event called sudden cardiac death. Basically, that starves the brain of oxygen. A person passes out, and in 7 minutes, they're dead. The ambulance can't even get there in time. And it happens quite often. It happens to about 100,000 athletes a year. And it doesn't just affect people who are overweight or have a bad diet. It happens to marathon runners. It happens to guys lifting weights. It has to do with the electrical beat of the heart. Every beat of the heart is producing electricity. And your heart desperately needs electrolytes. So magnesium, potassium, sodium, calcium, chlorine. Also, arginine has been shown to greatly enhance and to correct a lot of the electrical output problems in the heart, as well as a host of other things, blood pressure, diabetes, circulation issues, anything to do with erectile dysfunction and that sort of thing. But that's something we can get into a little bit later, talking about Louis Ignarro and the scientists who actually discovered nitric oxide in the 90s and won a Nobel Prize in medicine and science. Again, when it comes to electrolytes, we need to consider that drinking a ton of water is not a good thing, actually. It's flushing the cardiac cells, the electrolytes out of the cardiac cells. The electrolytes are what allows the heart to create its own electricity. Well, it's a big part of that process. You're damaging your body if you drink too much water. So if you're going to be athletic or even not, drink the water and add electrolytes to the water. The heart and the vessels, arteries, and circulation system are the key to everything. So don't flush what your heart needs down the toilet. Put electrolytes in your water. Now, how many beats are missed in the test? Well, a missed beat is normal. That can be just a premature ventricular contraction. What we're looking for is 80% or better. So when someone gets screened by me or by my technicians, you'll see that we're looking for 80% and above. And of course, 50 to 80% is when we need to consider getting it looked at. Anything less than 50% is seriously not good. Like, you need to go see a doctor. If we're out, let's say 35 out of 75, we've got an issue. Yeah, if it's 40 out of 80 or whatever it is, 50% or less, we need to see a doctor because you have an arrhythmia. Now, a person can sit down who has a heart murmur. Now, heart murmur doesn't happen all the time, but if you go to a doctor, you can go 10 times, he may never find it. So that's a tricky one. But if someone has a ventricle or fibrillation problem or an arrhythmia of some sort, and this test is showing 50%, you need to go to a doctor and have that looked at. Again, we're not diagnosing here, we're discovering and interpreting data. So please get the findings evaluated from a medical doctor and get a formal diagnosis. So that's recognition. That's what we're looking for, the electrical output of the heart, and something normally costing hundreds of dollars in the US to be tested for. An EKG, it's about $500. So when we're looking at ejection time, doctors measure something called ejection fraction. Now, they use an ultrasound or an echocardiogram to do that. Of course, this is another expensive test in the US, about $500, and something that is just not offered in terms of prevention here in Canada. Basically, what it's doing is measuring how much blood is coming out of the heart, and this is what's coming through the aorta every second, so how much blood is coming out. The less amount of blood, the weaker the heart. That ejection fraction is critical. So we're not really measuring ejection fraction, we're actually measuring ejection time. Ejection time is the speed of the opening of the aortic valve, the contractions of the left ventricle chamber where the blood's coming out. The faster that it's contracting, or the faster that valve's opening and closing, the weaker the heart. The higher that number is, the weaker the heart. And of course, since your heart is beating 3.5 billion times or 2.5 billion times in your lifetime, well, we want it to actually get there. And, in mechanical engineering, if a pump gets wear and tear, it's going to break down faster. So we want to keep that heart nice and healthy. Below the normal levels, when we're looking at ejection time, it could be hypertension, it could be high blood pressure, it could be hyperthyroid or anxiety. Now, if it's over 380, it could be aortic stenosis, which means blockage within the aorta. And of course, the aorta is the main artery of the body. And we want to determine whether there's a decrease in cardiac output. Because a decrease in cardiac output means that we have a weaker heart with a higher number. Usually when that number's around 500 or 450, we're going to ask people, when you go up a flight of stairs, are you normally winded or are you short of breath? That's because you're having a lack of output on the heart. A lack of blood flow means lack of oxygen throughout the entire body. Now, certain hypertension or high blood pressure medicine will also cause this condition. Beta blockers, calcium channel blockers will slow down the heart rate. That's how they adjust blood pressure. It's not solving the problem, it's just treating the symptom, which is a higher number. Now, what happens when, let's say, they're treating a tachycardia or elevated heart rate is they're going to use medication, digoxin, clonidine, lithium, beta blockers, calcium channel blockers. And what happens is something called a biphasic effect. And when you slow down the heart rate, what you're actually doing is you're slowing down the amount of blood that's going out of that heart to the rest of the body. Then the rest of the body begins to break down. The kidneys, the pancreas, the liver, everything begins to slow down because it's not getting the amount of oxygen and blood that it's supposed to get. Now, the leading cause of congestive heart failures is about 5 million people. So you're looking at 500,000 new cases every year is the beta blockers and the calcium channel blockers. They lower your blood pressure, but they'll cause congestive heart failure. The idea is to become aware of the side effects of these medications you're taking. The closer you are to 300 in your ejection time, the closer you are to perfect. So basically 260 to 380 is the normal range, and the closer to 300, the better. So the normal range of a pulse rate, a resting heart rate for an adult is usually 65 to 80. Now, everything that we tell everyone who gets screened is on the interpretive guide that we supply that they get to take home with them. Now, if it's under 65, that could be a couple things. It could be it's a well-conditioned athlete. Now, someone that runs 20 miles a day or whatever, and that's awesome because, the slower the heart and the slower the heart rate, the less it's working. So the faster the heart, the quicker it's pounding away, you're shortening the lifespan of the heart because it's working too hard. Now, if it's under 65, it could be congenital slow pulse, and you've had this since childhood, and the doctor would already know about this. It could also be hyperthyroid, which is really more common in women. Could be hypothermia or malnutrition. And then it could be heart medications. Again, these beta blockers, calcium channel blockers, things like clonidine, digoxin, lithium. And these things slow down the heart rate, which is not a good thing. Once again, it leads to congestive heart failure down the line, or it could lead to other complications with the liver, the kidneys, and so on and so forth. Now, if it's normal and you're an athlete, that's fine. We can normally tell if someone has a 47 heart rate, and if they're 100 pounds overweight, that they're most likely not running 20 miles a day. So we know that they're most likely on one of the mentioned medications or something slowing down their heart rate. Now, the goal is, and really should be for everyone, to live a nice long life and to eventually get off of those medications. The body's essentially designed to live 120 years and not 75 like a lot of the population. And I guarantee you don't have to throw a stone very far to hit someone who's been affected by a tragic cardiac event. And really, family and friends don't have to die in their early 50s. These are tragedies we'd like to help families avoid, especially when that loss is completely preventable in most cases. So if the heart rate's above 80 beats per minute, that could be because someone just got finished working out. It could be pregnancy, could be high anxiety, excitability, or someone's got pent-up anger. And anger and stress actually aggravate and contribute to cardiovascular disease in a huge way. So this could also be caused by fever, you're tensed up, high blood pressure, could be low blood pressure for that matter, could be a lack of iron or anemia, could also be blood loss through menstruation, could be hyperthyroid, hypoglycemia, could be panic disorder. Most of the time when it's a little high, like 85 to 90, we usually ask, if someone had chocolate or caffeine, coffee, green tea, pop, etc. Also, people taking Benadryl, Claritin for allergies or asthmatic medication, or people taking ephedra-based products like Actifed, Sudafed for colds or whatever. These pick up the heart rate a little bit, and in that case, it's really not a big deal. We're looking for a heart rate over 100, because if it's over 100, really want to slow that down. That's tachycardia. So this rapid heart rate, people are usually aware of it because they've most likely been to a doctor if they've had it for quite some time. Now, the great thing about nitric oxide, besides helping establish a normal electrical rhythm, it also helps to establish a normal heart rate. So people with rapid heart rate desperately need that. Now, we never advocate people stopping their medications, but we do believe being educated about the dangers, the side effects, and potential hazards of taking these meds, especially mixing multiple ones, as the research just isn't there, and a massive amount of people die from prescribed medications every year. These are actually, well, they're quite toxic and well known to cause heart attacks even. So these statin drugs and beta blockers, calcium channel blockers causing congestive heart failure. It really needs to be addressed. And of course, working with a naturopath is becoming quite recognized as a viable way for people to hopefully get off of these medications and, again, live a nice, long, healthy life. So when we look at pulse height, what this is measuring is actually something called stroke volume, or the amount of fluid that's going through your body, the water, etc. Now, the normal range for this pulse height is actually 2.0 to 8.0. We're measuring the force of that fluid, the powerfulness or the stroke of it. If it's under 2.0, it can mean one of three things. It could be blood pressure, low blood pressure. And generally people know if they have low blood pressure. Could be hypothyroidism. Again, it's really much more common in women than it is in men. Some of the symptoms you can actually tell on your own could be thinning hair, brittle nails, dry skin, lack of energy, hard to keep the weight off because of metabolism slow, hard to sleep, irritableness. Now, pulse height can also mean, if it's below 2.0, that there's dehydration or not enough fluid. If you have these symptoms, there's a home test you can do that's very accurate, and you can do this confidently and confidentially and avoid having to go to the doctor. Just basically go on Amazon and order their home thyroid testing kit. Now, a lot of people drink a ton of water thinking they're actually hydrating themselves, when in fact it really boils down to whether that water has electrolytes or minerals, because you're actually causing damage by drinking all of that water. Your cells are made up of water, but they need those electrolytes, almost like a key to a lock. You really don't need that much water as long as you're getting the electrolytes. So that could be the reason why you'd be coming out under 2.0 in a pulse height. Now, if it's over 8.0, there are different reasons for that as well. Now, heavy exercise being one, you just got done working out. Once again, pregnancy, could be fever, high anxiety, blood pressure, fluid overload, so retaining fluids. And because some people are salt sensitive and they retain fluids because of that. It could be hypothyroid, once again, anemia or a lack of iron. Any of those reasons could be why it's above 8.0. So when we look at the PTG waveform, this plethysmograph or plethysmograph, we're actually measuring here is when the aorta valve opens. Now, before the blood comes out, there's an electrical wave that travels a lot faster than the blood does, and it goes to your toes and back. And this is what creates the electrical sign pattern that we're seeing in the DPA printout. So what we're measuring here is the up and down of that wave, the beautiness of that wave. Now, what we're looking for, first of all, is the wave normal or abnormal or regular or irregular? We want every peak to be regular, so no shortness, no flat lines. There are certain factors that can cause irregular waveforms, like metal pins from breaking a bone, like an ankle or an arm or leg, or even a stent, which is part of a procedure called percutaneous coronary intervention, or PCI, also known as coronary angioplasty. So that small mesh tube inserted into the arteries, blood vessels that carry away from the heart, to aid in healing or relieve an obstruction. So when that blood leaves the heart, there's a valve that aortic valve closes. And because it's a pressurized system, the blood crashes back up against that valve. Now, due to the elasticity or the rubberiness of the artery, that aorta, it'll create this dichrotic notch that we see at the top of the waveform. Because when that blood hits back up against there, the artery actually moves. And if you picture the aorta or a garden hose lined with concrete, you can visualize that, that blood is just shooting through there, and so is that waveform. So it's very stiff, and it's not moving. It's not elastic or pliable, and of course it's not able to vasodilate and constrict the way that it normally should. Now, 1 out of 200 people are hard to read as they've had a stent put in. And the other thing we're looking for in particular is that dichrotic notch. So again, when the blood returns to the heart and crashes up against the valve, it creates this beautiful bump. Now, around the age of 40, that dicrotic notch disappears unless you're working out and getting adequate amounts of exercise. We can actually tell by the results, really, if you're exercising enough. And, well, the proper types of exercising is something we can also get into in another portion. So go out there, get active, hike, swim, bike, run, you name it. This dicrotic notch is the elasticity of the aorta. It's the most important artery in the body, so we want it nice and elastic. We want that blood to kick back and create that nice big notch. The bigger the notch, the healthier the aorta is. Now, you don't have to look like an athlete or be an athlete, but please spend some time doing some exercise on a regular basis. Join a meetup group. 3 to 5 days a week is great, but just do something. People do have a dicrotic notch that don't exercise, but normally that's because they've got a physically demanding job or they're getting a lot of physically active parts of their day from their work. We're looking at an APG waveform. It's actually something called an accelerated plethysmograph or plethysmograph. Now, what we're looking at here is the large and the small arteries. So this is a circulation analysis. Your body's made up of 6 large arteries, the biggest being the aorta, which is, again, a little bit in diameter like a garden hose. The smaller arteries feed off the large ones, and they're spaghetti-like. Then there are the capillaries, or the peripheral arteries. Those are the farthest away. So your fingertips, your fingers, ankles, the toes, the ankles, they're anywhere from hair-like, so the size of a hair, to 10 of them equal a hair, so they're microscopic. Now, you're made up of 100,000 miles of arteries, veins, and capillaries, which some, if not all of you, probably heard that if you cut open and string them end to end, they would reach around the world 2.5 times. What we're looking at here is simply arteriosclerosis of the large and small arteries. The capillaries have nothing to do with this, really. We're looking at how elastic they are. As you get older, they lose that elasticity. It's important to understand that, like your heart pumps, your arteries pump as well. They're not just pipe like plumbing in a wall. The blood gets pumped along the way. Your arteries need that elasticity to pump the blood. When they can't pump blood efficiently, that's when issues come up about like high blood pressure, diabetes, and so on and so forth. And we're looking at these patterns of the APG waveform in order to determine where you fall on the spectrum of arterial elasticity and hardness. We gauge this through a grading system from A to G, or 1 through 7. This is just measuring arteriosclerosis of the large and small arteries. It's a critical part of the digital pulse wave analysis test. There aren't many devices in the hospital that can measure arteriosclerosis, the hardness, the elasticity of the arteries. The DPA machine does this through software. The mathematics are extremely accurate in measuring the speed of the wave. The faster the wave, the worse off the arteries are. The slower, the better. As you can see when we're looking at the APG waveform, there's a very specific sine wave that's produced that we can analyze to determine the level of stiffness. And of course, that's a main indicator of what type of plaque buildup there is in the arteries. So when you look at an A type, and then followed by the B type all the way to G, A is actually the exact opposite, or pretty close to an opposite of the G type, which is going from a normal artery, which of course, you would find in a 9-year-old or a 12-year-old or whatever, and then to a G type, which you would expect to find in someone who's elderly, but more and more commonly these days is actually being found in people in their 30s, their 40s. And of course, heart disease is the number one killer in the world, and a silent one at that. So if you're coming out a G-type from an APG, then you really need to get yourself to a doctor, because you would be called what we're classifying as a clinical event through the digital pulse wave analysis. You can see a normal blood vessel should be nice and clear and clean, and abnormal blood vessels full of plaque that has accumulated could be over the course of years, but of course there could be chronic conditions that affect the efficacy of the plaque buildup, so to speak. Now, if your biological age grade is coming out as an A or a B type, which most people do come under, as we all have endothelial dysfunction once we reach a certain age. But if you're coming out an F or a G, then you really need to get that looked at, formally diagnosed, so that you can take a holistic approach to dealing with the issues that have occurred. So if the APG is an A, B, or C, we would recommend people getting retested every 6 months to a year. And of course, if it's a D or an E, get retested in about 6 weeks after following the recommendations that we provide or a naturopath provides, or of course what the medical professional cardiologist or an MD provides. And if the APG is an F or a G, well, you really need to immediately go see your doctor or find a doctor that will see you, and of course take the DPA test results with you, because it is recognized medical equipment and it should be viewed as such and respected to the point where we can fast track people through the medical system and hopefully save some lives.